Hello and welcome to Health Professional Radio. Thank you so much for tuning in today. I'm your host, Neal Howard, and I'm in studio today with a returning guest, Dr. Pepper Schwartz. She's a professor of sociology at the University of Washington and also a leading relationship expert on Lifetime's Married at First Sight. She's been with us before in other segments talking about female sexual dysfunction, also talking about the impact of a healthy sex life. And she's returning with us to talk about the Find My Spark initiative by the American Sexual Health Association. Welcome back to the program, Dr. Pepper Schwartz.
Thank you. I'm glad to be here.
Our listeners are mostly healthcare professionals, and you gave us a bit about your background when you were here before. Now, you are a professor of sociology at the University of Washington, so you're not a medical doctor, but your area of expertise has a lot of impact on women's health, not only sexual health. Is that right?
That's correct. I find myself doing workshops and lecturing and doing research on how sexuality affects both personal well-being in the psychological sense and also how it's associated with other kind of health behaviors and outcomes. So, I think of myself as somebody who both produces knowledge and tries to disseminate it.
Now, there was a new study that showed that Americans are having, less sex. Why do you think that is, and are you surprised being a researcher in this field of female sexual dysfunction and sexual health?
Well, I was a little bit surprised by that article, but of course it makes some sense to me. There were two major findings in that. They certainly found the differences by age. That's not a surprise. But they also found that in each age group, the amount of sexual frequency had gone down. And they didn't really offer a explanation. There was a good piece of research on a national study. They held a lot of things constant. But I think they opened it up to the reader to think about what the explanations might be. So my surmise on that is that I think we are distracted from each other by the pace of life and also by what that takes away from the kind of time where you would be able to have a sexual experience, in the way you want to have it. I think people go to bed later. I think they have many more devices that reach into their time, and I think that all of this has had some kind of impact. I don't think there's anything in the study that says we enjoy it less when we enjoy it, but we definitely have less time, I assume, or less energy to have it in.
Male sexual dysfunction, it brings to mind all these avenues that you look into. Not to say that female sexual health or sexual dysfunction can be any, less easy to understand. In the media, in magazines, in movies, in conversation, if a woman is not in the mood, it's because she doesn't like you, like someone else, has a headache, is tired. Oh, okay, I guess that's what it is. How do you raise awareness into the complexities of female sexual dysfunction?
Well, I think to some extent we know that female sexuality is a different kind of complexity from male sexuality. There was a joke going down the internet once where it showed male sexuality and had a switch, an on and off switch, and then it showed a picture of female sexuality and it looked like the inside of an airplane cockpit, with all kinds of dials and switches and whatever. And I think there's something to that. We have to understand that we are talking about something complex, and I don't want to underestimate the complexity of male sexuality either. But for the moment, I think what we have to say is, okay, we're looking at something that is both mental and physical, and it may be something where women themselves don't really, understand why they've lost their responsiveness. There's many women, 49% of the women in a large Harris poll of 2,500 women randomly selected, 49% of them talked about sustained, at least sometimes having a loss of sexual arousal and desire that they couldn't pinpoint. It wasn't to a medication. It had nothing to do with their relationship, nothing to do with health problems. It wasn't involved with pregnancy or breastfeeding or menopause. There was no other reason for it. And those women feel bereft. They don't know what to do about it. So it's not just men who, are looking for a simple explanation, but women would like one too, and sometimes it's not there. And so what we do is try and do a educational to say, this is complex. You're going to have to look at a lot of variables to understand it. And sometimes there might be a medical condition. There might be a physiological reason, and you're going to have to be empowered and, to some extent, an advocate with health providers to say, let's trace this thing down. Let's see what's going on. And that's one reason we created a website called findmyspark.com, which is co-sponsored with the American Sexual Health Association to give women a diagnostic, to even have health providers use this diagnostic to see, let's like any other investigative detective work, let's look at all the competing explanations and see which one seems to be the one that gives us a lead.
Can a woman or a man or a healthcare provider find answers at findmyspark.com when it comes to simply starting the conversation? I'm sure that the conversation between a woman and her partner, a woman and her friend, and a woman and her healthcare provider are all going to be different. Or can Find My Spark throw something out there that's all inclusive that she can talk with everyone about on the same level to get some help?
Well, everyone likes to solve a problem in their own way. So Find My Spark does that. It has a diagnostic questionnaire to see, what are the kinds of competing explanations might be for this feeling. It has several videos from medical doctors who talk about various physiological explanations. It has information on a community board where women can talk to each other and share stories and see how they can support each other or what they can learn from each other. And it has directions for other resources so that people can find their way the way they want to. And we're all very different. That's why we all need different tools and different kinds of explanations. Some of us like it orally. We listen to things. Others read it. Others want face-to-face interactions. FindMySpark.com gives you all those different directions so that, the conversation can begin. And honestly, that's where it all has to begin. We have to think about our body, how it's working, how we feel about it, what we might look for in terms of making it, just understanding it and seeing if we can get back what we prize. I don't know about you, but I consider my ability to be sexual, to desire my partner, to enjoy sexuality as a pretty prized part of who I am. And I wouldn't write it off for anybody. I mean, yes, some people deal with it. Some people pack it away. But if it's distressing, if it's been going on 6 months or longer, you don't think it has any situational explanations, and you are upset about it, if you're not, so be it. It's your life. But if you're upset about it, then I'm hoping that this is one of the ways people can talk to each other and maybe talk to a health provider or know how to either approach a health provider or a health provider can understand how to approach a client. The conversation's important.
Just knowing that you're not the only one that is experiencing something, you're not the only one that doesn't have a clue about what's not going on. They can find answers at Find My Spark, different forums and even directions to other information.
Absolutely. That's what the women's movement showed us. Just having a community of others to talk to and puzzle with and think about it with is liberating and empowering and ultimately extremely helpful in helping us find ways to have the life we want.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with returning guest Dr. Pepper Schwartz. And she's been with us talking about some great information there at findmyspark.com. Thank you so much for returning with us today, Dr. Schwartz.
Oh, I appreciate it. It's really been a great experience.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.